the last end of the anatomy, the neuroanatomy, and of which we are going through the brain and the neural tissue structures. Of here today and next day we are going to cover the coverings of the brain and some modifications on the coverings of the brain. So, these 2 hours we will be utilizing to understand or get a concept on the coverings to the brain which are present and the modifications to it. Now, whenever you have studied this abdomen or the thorax, we do have a covering to that particular regions. We call them as mesentery, we call them as pericardium, pleura, etc., etc. Likewise, in the brain region, we also have a soft tissue coverings. We call them as meninges. So, the neural content which is present in covering the brain, we call them as cranial meninges, and that what is covering the spinal cord, we call them as spinal meninges. Now, for us today, we are going to cover this content which is covered or related to this particular cranial parts or cranial parts of these meninges, we call them as cranial meninges. Now, within this particular cranial meninges, we have some modifications, that is what we are going to focus. And within this particular modification, we have some important structures that is present to it, which is an internal entry content as the brain is present. Now, before we move into these contents of these particular regions, we have to understand a simple fact that we are going to refer many times about sinus. So, we have encountered the word sinus many times in different occasions, and we have referred to different regions about the sinuses. Now, in here, this particular sinuses are present in the brain region where we refer to as venous sinus. So, the venous sinuses are nothing but the vascular channels that is present in the brain, which is can be equivalently compared as veins. So, the veins in the brain which do not have the exact replica of the veins that we have in the systemic circulation. In case of this particular modified venous channel that we have in the neural system, we call them as venous sinuses. So, this particular venous sinuses that we are going to refer here is the venous channel, which is kind of reciprocally can be called as veins in the brain. So, that is what we are going to talk about. Now, we divide this particular sessions in 2 parts. For the day, now today we are going to talk about this particular meninges, what are the layers of the meninges and some of the meningeal modifications. We call them as folds of the meninges, and out of this particular meninges, a particular layer within this particular meninges that we are going to refer today as dural layer meningeal folds or modifications of the dural folds. That is what we are going to talk about, what are they, how they are located and how do they matter. Now, within this particular dual folds of this meninges, we have some kind of structures that is we referred here as the veins in the brain, we call them as venous sinuses. So, this is like sector 2 of that, which are present within this particular meningeal layers or this particular cranial tissues, and they are known as dural venous sinuses. So, these are the basic gross thing. Related to linking up these 2 elements like dural folds and the sinuses, we have this particular clinical problems or applied importance. So, clubbing 3 together, we are going to get this clinical problem scenarios which is related to the meninges, to this particular dural sinus and their positions accordingly, and how do they present to us clinically when they are affected or infected. So, first for this time, for this afternoon, we are heading to this particular brain and meningeal layers of the brain which is related to it, and we will restrict to this particular understanding the different modifications of it. The next day, next session, we will talk about this particular folds which contains the structures, we call them as venous sinuses and their clinical applications. So, the first part or the part which are going to refer today, we call them as meninges of the brain. So, it is kind of like a fibrous covering which contains vascular content as well as neural contents within this central nervous system covering this particular brain. Out here we refer here brain as the cerebral hemisphere, the brain hemisphere right and left split into 2, joined by this particular connective tissue or joined by the neural tissue, we call them as corpus callosum, And then we have a part of the brain, we call them as cerebellum. So that is balance organ that we have, so that we can stay and walk and just move in a manner the way we want. So that balancing organ of the brain, we call them a cerebellum, which is also having two halves. We call them a cerebellar hemisphere, right and left. And again joining these two, and again joining this particular brain, cerebrum, cerebellum, to this particular lower part or continuations of the brain, we call them as spinal cord. In between them we have a tissue or neural tissue, we call them as brain stem. So the brain stem is split into three parts: midbrain, pons and medulla. So this is how the brain is narrated. It has a cerebrum and it has this part, we call them as spinal cord. In between them we have the cerebellum and brain stem joining between them. So this is how this particular whole thing is covered. Now for the day, we are referring to this particular content or the meninges, which is covering the brain and this particular cerebrum particularly, and the cerebellar hemisphere including the brain stem. So this part we call them as meninges of the brain, which has got three layers. We have to know this particular name of these three layers and how they are placed. So these meninges have got three layers. From outside to inside, we have three layers. We call them as Dura Mater, Arachnoid matter and Pia mater. So these are the three layers outside to in, they are present. That means if you crack the skull, then you get into the coverings of the brain, which is known as meninges or cranial meninges. The outer layer of that we call them as Dura Mater. Then if you cut the Dura Mater, you get into another layer, we call them as Arachnoid matter. Then you cut that, you get into this particular layer of this meninges, we call them as Pia mater, and then you get into the brain tissue substance. Just like we have this mesentery, parietal layer, visceral layer, etc. etc. Now within this particular meningeal sub-layers, we have some spaces between them, and through the spaces, it runs some vascular structures, neural structures, and it holds some kind of fluid inside. We call them as cerebrospinal fluid. So this is how this whole architecture of these meninges is layered. So this is what you are seeing here is the skull, which has outer table, inner table. In between them we have this diploic layer, and then we have this particular meningeal layer starts under to it, which has got Dura Mater, which is light over there, and then we have this particular deep to there. We have this deep layer which is present in here, we call them as arachnoid, and within this particular arachnoid we see that vascular structure present to it, blood vessels and tiny strands are there, and then deep inside to it we have another layer which is lining this brain neural tissue itself. We call them as Pia mater. Now however, this is an representable structure, that schematic picture. In reality, between these particular layers we may not see these particular spaces. That's what we are spaced over here. This is kind of stretched, zoomed out to understand how this particular space actually exists. So in reality, this much of space do not exist. They are very delicate and tightly stitched structure. But to understand better, it's zoomed out and to see this content over there. Now you see that this particular Dura Mater, which is extending from this to this is the toughest and outermost and thickest layer. Then we have this particular arachnoid and the Pia mater between them. Now in all practical purpose, this Dura Mater and this next layer, which is the Pia mater, they are kind of blended with each other. So not much of space exists between the Dura Mater and arachnoid mater. They are kind of glued together. Under to this arachnoid mater and the Pia mater, we do have some spaces which is known as subarachnoid space. That space is occupied by the vessels, blood vessels, and as well as we have a fluid existing in it. We call them as subarachnoid space contained as cerebrospinal fluid. So this is how these things are arranged. So you have the outer layer, Dura Mater, then arachnoid and Pia mater, outer one which is a thick one, or thickest of all, covering the inner side of this particular skull, and they are supporting the brain. They are giving this particular vascular supply, the neural content which is running through this particular region, giving the sensory innervations to this part, and as well as they are kind of protective in nature. So this is how this whole cranial meninges are function. Now this is what we are referring here. This is a schematic picture. That's what we are seeing. This kind of stretched out here. In reality, we do not have that much of space existing in between them. So this is a skull bone, then we have this particular dura mater, then we have this particular arachnoid matters glued to each other, then we have the pia mater. Between this arachnoid and pia mater, we have a space, we call them as under the arachnoid, we call them as subarachnoid space. Now this subarachnoid space is filled by a clear fluid, we call them as cerebrospinal fluid. In short, we call them as CSF. So this is how the whole network is covered. Now, taking one at a time, how these things coming together. So this dura mater, we are taking it and splitting it. This is the most intrigue and most important structure for us for the day. So this dura mater, which is the outermost layer, have got two layers. So again, if you split these layers, cut it, you get this particular dura mater having two layers, outer layer and inner layer. So this outer layer of the dura mater, which is covering this particular inner side of the skull bones, we call them as endosteal layer. And the inside layer of the dura mater, we call them as meningeal layer. So these two layers matters to us. So this is where we are concerning to this particular modifications of the dura mater is concerned. So this is what we are coming to this dura mater. If you cut this dura mater and split this, zoom this out, we see that there are two sublayers exist in the dura mater. Outside endosteal layer, which is covering the outer inner surface of the skull bone, and meningeal layer. Now, between these two, the endosteal and this particular meningeal, usually they are fused, they are stitched, but at some times or some places they have gap within it. Now, within these gaps, they run through some blood vascular structures. So this particular modified regions of the dura mater, which is running between this endosteal layer and the meningeal layer, they have a modification. We call them as dural folds. So these dural folds are of our concern today. So this is what we are going to learn. So we are not talking about the rest of the layers. We are focusing only in the dura mater and the modifications of the dura mater, which are our exam questions. The modifications of the dura mater and what they are called. So this is our exam question, meningeal modifications of the dura mater. So we have the dura mater, have got two layers that we will know that there are different names are there. So this dura mater, out of that outer layer we call them as endosteal layer, inner one we call them as meningeal layer. That meningeal layer goes in some kind of folds. This meningeal layer to the folds over here in gross we call them as dural folds. So to be specific, not whole of this dura mater goes into folds. So the meningeal layer only, they gives into some kind of modifications. We call them as dural folds. So there are several dural folds are there. We are focusing in this particular dural folds, which are important for us, 4 of them. So we have to know the names of them, how they are positioned at them, and what important contents in terms of clinical importance lies to them. So this is for the class. Now, coming to these dural folds, out of that we have 4 fortunate layers, which is meningeal folds of the dural layer, which is here present in this particular meningeal layers of the brain or the central nervous system. Now, this particular dural folds we call them as Falx cerebri, Falx cerebelli, Tentorium cerebelli, and Diaphragma cell. So these are the 4 layers. They can be given as a 5 short mark questions about narrate and describe with the schematic pictures with the 4 dura mater folds with the clinical importance to it. This is how the exam can be framed in examination. Now, coming to each of them, how they are present, what they are kind of like a holding out there, and what clinical importance lies to them. We take one at a time. So this meningeal modification of the dura mater, which is present in here, we call them as Falx cerebri. So this Falx cerebri is a kind of dural meningeal fold which is running over here where I am rolling the cursor. So this is a fold of meninges which is present in this particular cerebral hemisphere, which is lying in this region. We call them as Falx cerebri. The next one we call them as Falx cerebelli. They are present in this region from here to here. Between this cerebellum, we call them as Falx cerebelli, which is again present in the midline between this particular part here to this particular cerebellum. So we call them as Falx cerebelli. So Falx cerebri, Falx cerebelli. Then we have a transverse running structures or meningeal fold. We call them as Tentorium cerebelli. So, Tentorium cerebelli, this one is running sagittal. Tentorium is running horizontal from right to left like this. So, we call them as Tentorium cerebelli. It looks like a tent, like the camping tent. So, we call them as Tentorium cerebelli running between these two, Falx cerebelli and Falx cerebri. So, this Falx cerebri ends here, stops here, then Falx cerebelli begins here. In between them, splitting, we have a transverse running tent, we call them as Tentorium cerebelli, which is running obliquely. And then in between this, anterior to it, between this particular sella turcica, we have another meningeal fold, we call them as diaphragma cell. So, these are the 4 folds, the positions of them are there. So, we are going to take each at a time and narrate and describe. So, let us take this particular dural fold in some other views. So, this is what we are referring here, where you see this particular brain sagittally split and removed. So, we do not see any neural tissues, we do not see the cerebrum, neither we see the cerebellum, only the meningeal fold Dura Mater exists here. So, this one which you are seeing here, grey shadow, looks like a half of a moon, sickle shaped structure, we call them as cerebral falx or falx cerebri between the right and the left cerebral hemisphere. So, this is extending from here to here. Then from here to here, we have a narrow tissue over there, meningeal fold, which is running between this particular cerebellum, right and left. We call them as cerebellar falx or falx cerebelli. In between them, we have this structure which is running obliquely like this. We call them as tent between this particular cerebellar hemisphere. We call them as Tentorium cerebelli. So, this is the third one. And coming over here, this is what you are seeing here is sphenoid bone. This is a sphenoidal ear sinus, and this is the body of the sphenoid. On top, we have this sella turcica, where the pituitary is placed. So, between this particular region, pituitary placed over here, we have another meningeal fold through which this particular pituitary is hanged here. This region we call them as sellar diaphragm or diaphragma Sellae. This is another meningeal dural fold which is existing here. So, 4 of them are there. We zoom this each of them and understand this. So, 4 of them could be together in your exam question or singly they can be given in exam questions, especially the cerebral hemisphere split between them. We have this Falx cerebri, which is present between the 2 cerebral hemispheres. This is another view that what you are seeing here, highlighting this particular dispositions of this transverse tent like Tentorium cerebelli. So, this is what you are seeing here is Falx cerebri, and under to it, which is not seen over here, is Falx cerebelli. Under to it, this narrow strip, and in between them we have this tent. We call them as Tentorium cerebelli. Tentorium cerebelli ends in front of this particular sphenoid bone. Between this sphenoid bone body over here, we have the diaphragma Sellae. So, these are the orientation of 4 meningeal fold. Now, we take this particular Falx cerebelli, Falx cerebri, Tentorium cerebelli and diaphragma Sellae for this class. First one, Falx cerebri. So, this particular Falx cerebri is a meningeal fold that is lying between the 2 cerebral hemisphere. We have the 2 half of the brain, right half and the left half. Between them, this particular meningeal fold is getting in. It looks like a half of a moon, sickle shaped. This one like a sickle. So, half of a moon. So, if you look at this particular tissue over there, this is the posterior part, this is the anterior part of this particular cranium, and this is how this Falx cerebri is extending from anterior to posterior. So, this is Tentorium cerebelli, number 5. This is the Falx cerebri between the cerebral hemisphere. Now, the Falx cerebri have 2 margins, you can see that. This is superior margin, this is inferior margin. The inferior margin is free. The superior margin is attached to this under surface of the skull bone. So, this margin which is marked over here number 2, which is free margin of Falx cerebri. Number 1 which is present into this particular region which is attached here, we call them as attached margin of Falx cerebri. Now, this is the anterior end, this is the posterior end. Anterior end, it is attached to this anterior side of the bone, which is frontal bone. Over here, we have a modification. We call them as crista galli. So, from anterior side, it is attached to this particular crista galli, to this bone over here in the frontal bone, and posteriorly, it is extending to this particular tentorium cerebelli. So, this is tentorium cerebelli, it is ending on it. So, anterior to posterior, above to below, this narration of the description of the Falx cerebri, that basic thing, 4-liner words that we have to know if you have to describe it. So, coming back, what we have started. So, we have talked about the meningeal folds of the dura mater. Now, out here, we are referring to the meningeal layer, we call them as, which is present between the two cerebral hemisphere. That means right half of the brain, left half of the brain. We have the modification of the meninges. Now, this particular meninges looks like half of a moon, and we call them as Falx cerebri. Now, how do this Falx cerebri extend? Anterior to posterior, between the frontal bone to the back side, tentorium cerebelli. In this bony landmark to the frontal bone over here, we call them as crista galli. If you do not remember the crista galli, it's fine. Frontal bone to the front, back side, tentorium cerebelli, it is ending. It has two margins, one margin above, one margin below. One margin above is attached to the bone. The margin which is not attached, we call them as free margin. So, this is the description. Looks like margins, anterior extend, posterior extend of Falx cerebri. What it is? Meningeal fold. Which meningeal fold? Dura Mater meningeal fold. Which layer of the Dura Mater? Meningeal layer of the Dura Mater makes this modification. Now, what does it contain? It contains venous sinus. It contains some sinuses. We are going to break the names later on, the names of the sinuses. First, we learn these particular names and description of it. So, this is about Falx cerebri, anterior, posterior, above, below, how they are placed. You get to this orientation, later on come to these particular names of it. So, this is another visual which you are seeing here, front to back, frontal bone to the tentorium cerebelli, free margin, attached margin, hold some dural sinuses, and this particular thing splitting or placed between the right brain and left brain. Next part, next fold, which is known as Falx cerebelli, just like the Falx cerebri. This particular fold of meninges is lying between the two cerebellar lobes. That means cerebellum have got two lobes, right cerebellar lobe, left cerebellar lobe, just like the right half of the upper brain, lower brain. So, between these particular two cerebellar hemisphere, we have a meningeal modification or fold. We call them as the Falx cerebelli. How do they look like? Same, sickle, half of a moon. How do this particular thing course? This particular thing courses from this tentorium cerebelli over here from above, and below it is running through this particular occipital bone. This occipital bone groove, we call them as crest. So, occipital bone midline is running here, we call them as internal occipital crest. So, it is running from this particular tentorium cerebelli above to this particular occipital crest going into this part. Likewise, it has same thing, attached part to the bones, free part to this particular sides where it has attached to it. So, this particular Falx cerebelli, which is like this one, sickle shaped. Under this tentorium cerebelli, this is the tentorium cerebelli, this part Falx cerebri, this one is Falx cerebelli. So, Falx cerebelli, sickle shaped, anterior free margin, posterior attached margin, extending above from the under surface of the tentorium cerebelli, below it is attached to this particular crest of the occipital bone, we call them as internal occipital crest. Where they are present? They are present between the right half of the cerebellum, left half of the cerebellum. This is how this particular Falx cerebri and Falx cerebelli placed. These are the two entities, how they are placed. Now, coming to this particular third entity, we call them as tent of the brain. That means this is a tent which is basically present in the posterior part of the brain. So, this particular brain or cavity of the brain can be divided into three parts. We call them as cranial fossa. Now, this cranial fossa have got three segments. We call them as as anterior cranial fossa. That is related to the posterior half of the brain. If you see this particular brain is running like this, posterior half is the occipital part and this is the frontal part. Now to the posterior part, we have another lobe of the brain existing. We call them as cerebellum. So between this cerebellum and the cerebrum posteriorly, we have this tent existing. We call them as Tentorium cerebelli. So this is how this tent is placed, or Tentorium cerebelli is placed between the occipital lobe of the brain and the cerebellum. This is how this Falx cerebri is placed, and this is how Tentorium cerebelli, Falx cerebelli is placed. So number 1, number 2, and this is number 3. Number 1 is Falx cerebri, number 2 is cerebelli, number 3 is Tentorium cerebelli. So this is how this 3 cerebelli is oriented. You have to know this particular orientation very well. So this is what we are referring here is Tentorium cerebelli. So this is a tent running horizontally, crisscross. So we have a better visual like this. So it is coming here and anchoring here, just like a tent between this Falx cerebri and Falx cerebelli. So if you look at it, this has an attached margin which is attached to the bones over here. Here we have placed transverse sinus which is running across this particular petrous part of the temporal bone, and attached to this particular ends of this particular bone we call them as hooks. These hooks we call them as clinoid process. So it is attached to this particular hooks of the sphenoid bone and running to this particular petrous part of the temporal bone attached, then falling into the occipital bone over here, we call them as transverse sinus, and meeting in the midline. So this is how this attached margin is there, and in between them we have a free margin of this particular Tentorium cerebelli existing. So Tentorium cerebelli, on top of it we have this superior surface which has got attachment of the Falx cerebri. Under to it we have attachments of the Falx cerebelli. So this is how this whole network is placed. So this particular Falx cerebelli and Falx cerebri is split between them. Now likewise this particular Falx cerebri and Falx cerebelli, this Tentorium cerebelli also hold these structures, venous sinuses. So same thing present within this particular Tentorium cerebelli, Falx cerebelli, Falx cerebri. Now coming to the third, this particular orientations over here, moving to the fourth part of it, which is the last thing that we are going to refer here. We call them as diaphragma Sellae. This too is a meningeal fold. Now where this particular meningeal fold is there, we have a midline bone over there. We call them as the sphenoid bone. So this particular sphenoid bone, superior surface of it, we have a cavity. That bony cavity, we call them as sella turcica. That sella turcica holds a important structure or neuroglandular structure. We call them as pituitary gland. So that pituitary gland is placed within the sella turcica. Now surrounding this particular margins of it, we have a fold of this particular meninges is attached to it. We call them as diaphragma sella. So within this particular cavity or the margins of the superior surface of the body of the sphenoid, anterior to posterior, we have a meningeal fold attached. Anteriorly it is attaching or running between this tuberculum sella to posteriorly, we call them as dorsum sella. If you do not remember this particular modified names of this particular superior surface of the body of the sphenoid, don't go by it. Just remember this. This thing exists between the superior surface of the sphenoid bone and making a cavity for this particular pituitary gland to pop in. so that the pituitary gland is hanged below and is covered around by a fold of meninges which is present to it. So this is, we call them as diaphragma Sellae. They run like a diaphragm which has a slit to it, where through this particular hypophyseal cerebri, also known as pituitary gland, is hanged in. So these margins, we call them as diaphragma Sellae. So these are the four things of the meningeal fold that we are referring to, that we are learning here. So this fold number 1, that's the important one, can be given as exam short note itself. Falx cerebri, between the two cerebral hemisphere. How do they look like? How do they extend? What are the margins? Likewise, the lower extreme, Falx cerebelli. How do they look? How do they extend? Superiorly, inferiorly, attached and free margin. And what do they hold? Vascular structure, venous sinus. What they are holding, individual names, we are going to learn in subsequent classes. The third one, which is kind of like a rule breaker, we call them as Tentorium cerebelli, running obliquely between this particular Falx cerebri and Falx cerebelli. Between this particular margins, we have the attached margin and the free margins. Where this particular element is there throughout the brain? No. It is present in the posterior half of the brain. We call them as posterior cranial fossa. So it is present in the posterior half of the brain. Now, this particular meningeal fold, we call them as Tentorium cerebelli. They look like a tent and present between the cerebrum, occipital lobe and cerebellum, and that's why they are known as Tentorium cerebelli. Between the cerebrum and cerebellum, they are splitting in. So they are placed in here. This is how this is attached, and it has a free margin, attached margin. Again, what do they hold? They hold the vascular structure, the venous dural sinuses of the brain. The last one, diaphragma Sellae. This particular diaphragma Sellae, which is admitting the stalk of the pituitary, where they attached on the superior surface of the body of the sphenoid. The landmarks which is coming between the tuberculum sella to the dorsum sella. You remember the name? Fine. You do not remember the dorsum sella or this tuberculum sella? Let go. So this is the one thing that we have to keep in mind regard to these modifications of this element. Now the most important part to it, after the discussion is over, the nerve supply to this. Now see that this particular nerve supply of this meningeal fold or the dura, that means the sensory sensation we are referring here, that means touch, pain and temperature. Now this thing is divided into two halves. Into two simple landmarks, we divide this particular, the nerve supply of this meninges out here. So we have this Tentorium cerebelli running between them. Above the Tentorium, below the Tentorium. This is how the nerve supply is divided in. Above the Tentorium, the meninges, we call them as Supra-tentorial parts and Infra-tentorial meningeal folds. So what do landmark come here is the Tentorium cerebelli, which is the thing which splits the nerve supply above and below. So this nerve supply and the clinical presentations matters here. Above this Tentorium is supplied by cranial nerve number 5. That means trigeminal, our branches of the trigeminal supplies the nerve supply to the Dura Mater. Dura Mater folds above the Tentorium. Below this Tentorium, it is the spinal nerves or cervical spinal nerves. Now, how do they matter? This innervation difference above this Tentorium and below the Tentorium. Now, if you have a cerebrovascular accident, we call them as brain stroke. So, if you have a tumor which is growing above this particular Tentorium, so that particular element, if it is pressing, if it is creating pain, that pain will be carried through which cranial nerve? Branches of trigeminal. That means V1, V2, V3, and they will be radiating to the pain on this face and head ring region. Now, if you have similar thing under the tentorium, tumor, blood clot, anything, any disease, which nerve is carrying over here? Cervical spinal nerves. So, the pain and everything which is related to the under the tentorium will be radiated to the neck, to the shoulder. So, this is the hallmark difference of clinical presentation. A young individual having a tumor growing to this particular lower part of the tentorium, coming with the pain sensation, with this particular neck pain, shoulder pain, radiating pain, because the nerve supply to it coming from the cervical spinal nerves above face region to the domains of this particular region of the trigeminal branches V1, V2, V3. Explain why. So, these are the explain why questions related to this particular tentorium innervations or Dura Mater innervations and the radiations of the pain likewise. So, supra-tentorial headaches, infra-tentorial headaches could be from various regions. How these things are differentiated? These are the clinical things. And I hope you do not remember anything about this particular thing. Unless until you see the cases, then only you can just like refer it to it, or else this thing are garbage. But anyway, I just do not want to cloud this particular thing anymore with the contents, because these are complex entities related to the brain, and this orientations of the meninges is quite complex. No matter how I tell you that this is easy running between this and this, it's difficult to understand, visualize and things. But the clinical things matter to us more than that of descriptive thing, because this is what we are going to see our clinical patients. So, this innervations of this meninges above and below and the radiations of the pain will be there with you beyond this anatomy. Now, coming back to this anatomy, because you have to pass it before you reach to that part, and they want to know about this particular folds of the peritoneum, folds of this meninges, dural mater folds between these two cerebral hemisphere, right and left, falx cerebri, between the cerebellum, falx cerebelli, split in between them, tent between them, tentorium cerebelli. Between this diaphragma Sellae is between the pituitary. These are the four things. How do they look like? How do they extend? Remember that they have the all thing common over here. They have an attached margin, they have a free margin. Two of them look alike, half of the moon, sickle shaped. One of them have attachment to the bones, we call them as attached margin. One of them have a free margins. What do they hold? They hold blood vessels. What blood vessels we call in here? Dural venous sinus. What do? They carry the blood. What kind of blood? Deox blood. Deox blood carries through the veins. All these particular veins do not look like the veins the way we have seen. That's why you give a special name to it. We call them as dural venous sinuses. Now, where they are placed, what are different names? We are coming in the next classes. Apart from that, the nerve supply to them matters to us clinically. If you are dealing with some sort of intracranial hemorrhages or any kind of diseases affecting the Dura Maters. Above the tent and below the tent, we have two different groups of nerve supply. If you have pathology above the tent, that means we are carrying through the nerves is divisions of V, 1, 2 or 3. No matter how, they are going to supply this face forehead region. The pain will be radiating accordingly. If below that, it will be going down, drop down to the neck and the cervical regions, because they are carried through the spinal nerves which is present to it. For the next day, we are going to prepare for these particular modifications and the things. This is what we have seen so far: falx cerebri, falx cerebelli, tentorium cerebelli and diaphragma Sellae. This is the divisions of these nerves that we have seen: V1, V1, V2, V3, deep inside over there. So, if you have a very clear understanding of this particular innervations of this, you can precise this where exactly the blood clot is there. Following this patient complaint about the referred pain, we can precise it where exactly the blood has clot without doing any MRI, without doing any CT scans. But anyways, So, this is the neural innervation that we have talked and explain why questions can be framed based on these particular pictures.